channel. Today I have a special guest here. If you don't know her, her name is Onik DuVerge, and we went to school together. That's where we met at FAMU in before the respiratory program, but I didn't really want to talk to her like that before that. But I eventually got close. She begged me, so that's when I became her friend. But anyway, so me and her both started traveling pretty early in our career. So we we got about half and half of regular full-time position and then traveling. So today we made a video, or we're gonna make a video and tell you guys about the pros and cons of traveling. So since she's a special guest, I would have her go first and just say some of the pros and cons of traveling.
Okay, so...
Well, let's both start off with the pros.
Okay. So definitely the pay. It's like the same thing you'll be doing at a full-time, like a set job. You're getting paid more for it just for being a traveler. So 100% is the pay. Seeing the different cities. Oh, and you learn a whole lot of other stuff that you aren't familiar with, because every hospital is different and stuff. So you learn so much. Like these past 4 months when I was traveling in that hospital, I feel like I've been working for 10 years already because I've just been exposed to so many different things. But yeah, another pro. Experience, meeting new people with more experience than you, or them knowing different things than what you know. I'm teaching them and they're teaching me. It was a lot of that going on, and it was just so awesome. And especially meeting the therapists who are 50 years in the game and stuff, and it's dang, that's cool. They know so much more stuff. But it's pretty much.
She traveled in Texas, Dallas. We were both in Dallas, and we worked both for the same company, but we worked at two different hospitals. And I traveled Texas as well as Tampa. So the pros for me, the pay, of course, is amazing for doing what I do, at my age and stuff. It's just a good big pay difference, and I love it. Most times you get paid weekly instead of bi-weekly, so that's a benefit. And
I think 90% of the time.
It's 90% of the time is weekly pay, so that's really good. If you want some money in respiratory, travel. The other benefit is I love traveling. Ever since I was younger, my parents always took me to different states. Before I became an adult, I even went to 14 states with my parents, and then I went to Mexico when I was younger, 12th grade. And so I always loved traveling. So this is just giving me an opportunity to travel more and see different cities and actually work in the city. So it's I'm working in the city, so I can know the city more than just if I'm just sightseeing and stuff like that. So that's a really good benefit. You do meet a lot of different people from Mississippi, New York. And it's just they're all this is with the specific company we were with.
We see everybody.
From the specific company we were with, we seen everybody. So that was a benefit. But you do, when I was in Tampa, I just saw people mainly from Florida, but when I was in Texas, I saw people from all over, and I met a lot of people that had a lot more experience than me, some that kind of had the same experience as me. My favorite person in the world, her name is Sherry, and she has been a respiratory therapist for a while, and she always helped me. And she just showed she just told me about some of the things that they did, and I kind of compared it to Florida, what we did. So yeah, and then being in a different state, some states don't do what Florida does. In Florida, we intubate, A-line insertion, stuff like that. Texas, you don't do none of that. You still do a lot. We were still doing a lot, but they don't do that over there. In Tampa, when I was in Tampa,
cool. We get to experience not having to pull ABGs every second of the day,
Right,
or like
Yeah,
the nurses
it's really
helped
cool.
out a lot.
It's just different laws for different states. So
Oh, and what you were saying, like when we travel and stuff, another pro is like instead of just a sightseeing, we literally, I probably like without GPS could get to and from places without
Exactly,
GPS.
exactly.
And it's like if someone were to be like, oh, like do you have a spot in Dallas that you like to go to? I'd be able to tell them.
Oh yeah, Deep Ellum.
I'd literally be able to plan a whole Dallas trip for somebody.
Exactly.
I think that's so cool.
And just because we were traveling there, like that's not our city. Like we would have never thought. First off, we would have never thought we would have been traveling. Like if you would have told us, while we were like our graduation month, like okay, you about to get rich in a year. You about to be rich.
Less than a year.
Less than a year. You about to be rich with this respiratory stuff. You about to be in a different city, meeting all different people.
Meeting all different people.
You about to leave your full-time job, like. Crazy. It's a really good experience, and I love it because me and her both are the type of people, we don't like, routine. Y'all know that episode of SpongeBob where he just kept doing the same thing over and over.
No.
It was Squidward that kept doing that.
Mm-hmm.
And it's like I don't like that, and I was seeing my life getting really repetitive working where I was working in Orlando. It was just like
I don't see myself ever getting back to that routine.
Yeah, and I'm going back to a full-time job, but I mean it's a different city, new vibe.
We'll see how long that lasts.
Like you're not in a routine, like you're just doing stuff, meeting new people. I met
and
people
it's temporary.
in Tampa. Yeah, exactly. It's temporary.
You're not gonna, even if you're having a terrible time. First of all, you're getting paid so much great money. You just have to like get through it, finish your weekly assignments.
You look forward to an end date.
You look forward to an end date.
Like
instead
at a
of
full-time job, you just think,
when am I gonna get my next vacation?
This is my life. Like,
Yeah,
so,
I think that's the best feeling.
Exactly. Let me think. It's like you just learn different equipments, different respiratory equipment. Even for nursing, you learn different nursing equipment. You just learn the different, type of things. And this is, like I said, for anybody.
You meet awesome nurses. That's another pro.
Right.
Especially, you meet different people who will like teach you like more things. Like other than like the therapists, like doctors, cool doctors, and like young doctors.
Right.
Like the hospital that I was at was another teaching hospital. My first job was a teaching hospital, but this one was also one, and I met like more awesome doctors, young doctors, and like nurses who were experienced teaching new things and stuff.
I met a lot more doctors and talked to doctors and interacted with doctors in Texas.
Yeah.
And one is because I was day shift, but it was just like, of course, I was like more critical patients than I was where I was working before. And pretty much.
Feel so much more advanced now.
Exactly. We really feel more advanced. You do learn a lot, and it's a really good benefit. Okay, but now we're gonna talk about the cons, and we gotta go fast because the battery's about to die. But okay, so some of the cons with traveling. One, you kind of have to teach yourself some stuff. And it's because you're not gonna get a full-time. Orientation. So you're pretty much going to have to teach yourself and maneuver around yourself things that you don't know, and you don't get a full training. You have to learn the hospital, learn the charting system really fast.
Because most travelers, every traveler should be experienced either way. So
Exactly.
Just real quick on your feet.
Right. People treat you like crap.
Oh, yeah.
Like people be like, "Oh, the traveler." One, they hating because they ain't making the money.
They ain't
putting in the same. We're both putting in the same work, but we're getting paid more. So they be hating. So they will treat you like trash.
That's the biggest con.
Because I've heard people talking about me behind my back. Exactly. Like, come on, we're just thinking about the patient right now. I'm sorry that I get paid more. I mean,
I think that's the biggest con.
Yeah. Because, like I said, I heard multiple people talking behind my back at my last assignment, and It was just like, okay, because I'm also young and I'm making this money and I'm traveling. So you definitely give them something to talk about, but don't let that get in the way of,
because at the end of the
you
day,
taking
you're
care of
getting
the
there,
patient.
and you're there for one reason, taking care of
Exactly.
people. I tell them that all the time. Me and you are both here to take care of that. We have one thing to do, and that's to take care of this one patient.
You tell them that? She'll be telling them
I
that.
do. Like, if the nurses, they'll be like, oh, like, thank you so much. They'd be so surprised when I help them. And I'm like, we're both here to work.
Exactly.
Why wouldn't I help you? What else am I going to do? Like, I'm not grumpy or... I think a con for me is... like, even though I like traveling, I don't really like to be away from home, like, for so long.
Oh, yeah. It's not a stable lifestyle.
It's not a stable lifestyle.
Like, you're living in a hotel. Like, you just want to, sometimes you just want to. My camera died because I didn't charge it, knowing I had a video to do. So, we had a device switch. So, if you see the quality change, that's why. But anyways, so, what was we saying? Yeah, they talk shit about you. I've gotten walked on and me talking shit about. You have
not
to know.
Having a stable.
Oh yeah, not stable lifestyle. It's not stable. But I mean, you get to travel for free.
You gotta order food all the time.
Yeah, you gotta order food. Like it's unless you get like an Airbnb, you pretty much can't cook, or a hotel that has all that stuff. You pretty much can't cook unless you buy like an air fryer and stuff like that, but that's aggravating. Another con is that the charting systems, you have to learn them. Like, everybody knows that that's the most like crucial thing you have to do in the hospital is the charting. So,
or learning about new events that you never,
exactly. Like the Hamilton G5, I never ever saw that ever, not in clinicals, not in nothing. And they had that in Tampa, and I was just like, I don't really know about
I luckily had several eyes like throughout my whole like art.
Yeah, see, that's really good. Different devices like. In ORMC, I don't care. Y'all could know where I'm working. I'm tired of hiding it. That's where I was working for ORMC. Okay, so at ORMC, they use the OptiFlow, but they use Vapotherm in Texas, and they also use the Vapotherm in Tampa, and as well as the Airvo. So I kind of knew how to deal with those, only because clinicals, but yeah, it's just different devices you have to get used to.
Or like, I worked with Flowland for the first time in Texas.
Oh, yeah.
What was the other word for it? I forgot.
Yeah, I forgot. I'm sorry.
I'm gonna search it up.
Sorry about that. Yeah, they gave me 2 days of training in Tampa. In Dallas, they gave me 1 day of training. So, and some of the places, like, you'll have different work schedules. Like in Tampa, when I first started working in Tampa, it was 4 days a week, but then it became 3 days a week. So, yeah, but in Texas, we was working 6 days a week. But the thing is, that's not your life. You have an end date. You could be done.
Right,
soon.
you just have to get through the date that you set,
you're making that
and
money.
Then you take a break. It was miserable.
Yeah, it really was. But I mean, hey,
it was all worth it in the end. Because then we literally took a month.
2 months off. Yes, this is a big pro. We forgot about this big pro.
Yeah, that is a big pro.
That you could take months off and just be chilling, have money saved up. Most travelers I know, they take like
months off of not working, and then like the only reason most of them even go back to work is because it's like, hey, I've been like laying around for too long. Like I'm getting kind of bored having too much fun.
Exactly.
So it's like, let me go work for a little bit and then get back to having more fun.
We've been partying a lot, if you know.
And just because we have nothing.
Exactly, and we deserve it because we were really, really working hard, and we was working with COVID patients, so it's just like, it's draining. Like, I was crying in some patients' rooms. Like, it was really heartbreaking. So yeah, I am taking 2 months off, and I do deserve it. So
period.
Like, let me take 2 months off. And this is exactly why they mad. This is why they talking about me. Because
they can't take 2 months off.
Exactly. I'm sorry that you're going to have to keep doing this over and over and over again. Like,
yeah, it sucks that some people aren't allowed to travel. But if you do have a chance,
definitely do it. And I'm glad we got to do it now, because we don't have no kids, no responsibilities.
Right. So it's the perfect time to do it. And if you do want to do it, don't think about it. Just do it.
Exactly.
Like,
just do it. That's what we did. We just did it.
We literally got up one day and we're like, okay, let's go.
And it's good for nursing, X-ray technician, everybody could travel. So don't think just because you're not a respiratory therapist or a nurse that you can't travel, because you can travel. Just find a good agency and then you can do it. And be careful, because some agencies, I realized, because I did one contract with a company called Therapy of Staffing, and they were really good. Like, they gave me the stipend, they gave me my pay, but you just have to be careful with some traveling companies, because they'll try to add your stipend and pay as in one, so it's like you're really not making that much more, because you have to pay for your hotel and stuff like that. Luckily, in Texas, they paid for our hotel and everything, and they gave us a weekly stipend for food. But a lot of places, they'll give you, like, for example, they'll pay you like $50 an hour or something like that, and then they'll give you like $1,000 extra dollars for hotel and food. So just make sure they don't try to add those together, if that makes sense. So yeah, these are the pros and cons of traveling. If you have any questions, just comment below. Y'all know a lot of y'all, I see a lot of y'all writing me on Instagram. I love y'all for that. Write me on Instagram if you have any questions and stuff. And then I'm gonna do pros and cons of respiratory real soon. So yeah, keep you guys updated. Bye.
Bye, everyone.